Welcome back to Connect with Christina. And with me today is Dr. Cipollo, aka Samantha from Sex and the City. Just kidding. She's beautiful.
Oh, thank you.
I hope that's okay. I said that. We can redo your entrance if you want. Just kidding.
It's funny. A lot of people tell me that. It's funny.
First, because I have a lot of questions for you, I want to get this out of the way. Share with all of us your clinic and what you do with it and where it's located. Then I'm going to ask a bunch of questions.
Okay. I just opened my own office. It's in Mesa.
Congratulations.
Club. Thank you. And I have chiropractic, acupuncture, nutrition, and massage there. I feel like that's a great way to start a person on their health journey.
And your hours?
We work Monday through Friday. Tuesday, Thursday are half days. We get off at 12, and we're out by 12. And then the other days we're there till 5:30.
Okay.
An hour lunch.
You repeat the crossroads. Country club and what?
Country club, there's Pantera. It's a little bit, I believe, west of Costco. I'm still learning my my directions there.
You got really good food around you.
Yes. There's the buffet, the seafood buffet. We've sent my patients over there. They loved it. They're from Minnesota. They loved that one. But there's some other really nice restaurants around there too.
So I experienced my first acupuncture with this beautiful lady. And I don't know what you did, but I was like in Zen, in another like universe. And it didn't hurt. It didn't hurt. So I definitely want you to have access to her. And my question with that is, remind us, what is acupuncture good for?
Acupuncture is good for so many things. I like to just balance the body, because once the body's balanced, it starts healing itself. And that's what we did with you. I just balanced the body. It's used for pain, for arthritis, anxiety. It can help stimulate appetite. I had a patient the other day who's been so sick, couldn't eat, did a couple treatments. She started eating normally again. So many wonderful things.
So many benefits.
So many benefits. And again, when the body's balanced, it can heal so many things inside.
Yeah, like it's so many categories.
Yes.
That you don't even think about. I grew up hearing about it because my mom was all about that. I mean, how I know it's ancient, and how long has it been around? And it started from...
At least 5,000 years it's been around, and they still can't figure out exactly how it works. That's the thing that's so amazing to me. But in that light, it's like, see, we don't always know how everything works, but it works. Maybe we don't need to know right now, but it works. I studied Chinese acupuncture, but there's Korean, Japanese. In fact, I have a patient that's going to Japan. I'm like, try their acupuncture. Come tell me what it was about, but I studied the Chinese acupuncture here in Arizona, actually, with Dr. John Amaro. He passed about a year ago, but he was brilliant, and it's helped me so much, not only personally with my own body, but with many, many hundreds and hundreds of patients.
And that's what I want for them, right?
Yes.
I mean, for myself too. And by the way, I guess in my head, because I never tried it, I'm like, needles, oh my gosh.
I know.
Didn't even feel it.
I know. I wish I would have brought a needle just to show you. But a lot of people have this, they're going to get some kind of shot. The needles are big, but they're not. They're like fine pieces of hair that are just so bendable.
I just didn't feel it.
No.
And even in the parts where like I felt it, it was just like a little ant bite, if any.
Exactly. And it goes away right away.
With that treatment that I got, which I will come back for, like, I suppose it depends on what you guys need, what I need. But typically, like for a person to pursue better health, is that something you do like 3 times a week, or just,
It depends on the person's health. The patient I was telling you that was very sick, I was seeing her almost every other day for a couple weeks. They were going to take her gallbladder out. And I'm like, wait, can we try this first? Because once you lose your gallbladder, there's a whole thing that comes, and you've got to eat different down the road. And, I said, can we just try this first?
It's like a permanent thing.
As she was there the other day, she goes, I'm eating better. I feel so much better. You can just see it in her face. And I said, it was yesterday, in fact. And I said, they would have taken your gallbladder out, because once they open you, they're taking it. And look at, you're better just with the simple things that we've done, So I felt really good about that. She's young. She doesn't need to lose her gallbladder.
So, it's like when you're given this diagnosis, like, know that you should get another opinion and also seek other more holistic, if you will, approach before you just go into surgery.
Exactly. And I work with Western medicine also. I refer all the time back and forth, and it's complementary to some of the things that are, I have people that have cancer that are on chemo. It's complementary to what's being done. It will just help support their system. So it's important I feel like this is basic health, to balance your body, balance your spine, balance, your eating, those type of things. That should be like just what we do, but
like
it's
foundation. Not. But what is it about that helps people? Because I know for me, I just did it once and I'm like, what was that?
Yeah. All I did, Christina, was
But what is it? Like, why is it having that effect on our body?
They're not sure. They say that it stimulates the circulation. This is just me, and I have never said this publicly. I tell this to patients, but I feel like it works not only on the circulatory system, but it works on the electrical system of our body. And by putting the needle in a certain point, that it stimulates that point, maybe a little electrical charge or something to reset that. We talked about vibration. When you're sick and have dis-ease, the vibration of the bodies are off. We know that from quantum physics. It's about vibration, And so when that's off, you get sick. Or if you get trauma, or if you have major, like a physical or emotional thing, trauma, or somebody maybe passes or grieving, it really affects the body. And Eastern medicine talks a lot about that.
Yeah, even like traumatizing things like divorce, all that
all
stuff.
of those things, because the body grieves. And there's a good book called The Body Remembers Everything or something like that. But it's true. I've seen it. I've worked with people and I'll ask them, did you ever fall or have a bad accident? They'll be like, no. And then I'll come back a couple of days. You know what? I remember now I did. I fell down the stairs or whatever. And I tell them, your body remembered that. And a lot of times during treatment, you don't always feel good at first because those things are coming to the surface to be healed, for the body to realign and to have those things healed. I've seen it so many times.
Well, and that's why it's been around forever, right?
Yeah.
Our parents. My mom for sure. She was all about it. I wasn't, because I'm like, needles, stay away from me. But then I experienced it with you and I'm like, didn't feel anything other than first of all, I knocked out.
You did.
And I was so relaxed.
You did.
But you also did something to my brain. And Justin, she did something. I don't know what it is, but I stopped thinking and fell asleep. What was that?
I think I used the laser on you, the cold laser, the Zirconia cold laser. There's settings just to calm the body down. So along with balancing the body, we just, I remember put the laser on you just to calm the brain down.
Marsha woke me up, Marsha Dufern with PIC, shout out. I got started because I was so deep into my sleep. It was the craziest thing. So I know I definitely want to see you again for sure. And even, you're not going to know until you try it. And I feel like people are walking around doing life and taking care of responsibilities, and they deal with the way they feel because they don't know they can feel better. Right. And then there's some who just are, warriors, and they just deal with the pain. Right. So it's nice to know that this is something you can, try. You owe it to yourself.
I love chiropractic and acupuncture, and I feel like everybody should experience it. Even if you didn't get a good experience, do yourself a favor and try it again, because they really work, And I like to give a complimentary acupuncture patient.
There you go. Right here. Call Christina now.
I do, because people want to try it. They don't know where to go. Not every practitioner practices 100% the way, I have a certain way that I practice, but it's a great tool to have to help somebody get well.
Yeah, I'll definitely, just from here, if you're able to do that, like basically like a trial, it's very generous of you.
Yeah, you have nothing to lose.
Yeah.
Nothing to lose, everything to win. And it's a tool. For me, it's one of the tools I have in my toolbox to help people get well. Chiropractic, acupuncture, nutrition. I have massage therapists there. Those are the basic things to start a body to get well.
We might need help with that nutrition thing too. No one's getting enough protein and among other things.
That's true.
You know?
Yeah, it's really crazy.
Well, how come you combined those four? Was it like on purpose, intentionally, because you know those are the foundations?
So my dad was a chiropractor and he practiced acupuncture. And I want to do everything that he did because he was great. I worked in his office in the summer and people would just be like, I love your dad. He's so great. He's helped me so much. I'd see people like hobble in and come out, you know. And he didn't do a whole lot of nutrition because it wasn't really big. People were eating better back then than they are now. Not so many fast foods and stuff. I saw that I saw that when you don't eat right, your body doesn't hold well. Like I've had patients that have been to other providers and they'd have to go like every day or every week, literally. Once I started adding nutrition, we started, you know, twice a week, and then every other week, and then once a month. I like to see patients at least once a month. It just keeps them healthy. But it changes how your body...
It's manageable too.
Yes.
You know?
Yeah, it really does. It's super important.
So being in personal injury though, right, I learned that people are only going to chiros when there's an accident. And it's like, guys, actually you need to be proactive and, you know, see these guys to do preventative work.
Always.
Do you agree?
I agree 100%. And even after you've had an accident, your body is never the same. It repairs with scar tissue. That tissue is not as elastic. It's more prone to injury, more prone to pain. So why wouldn't you continue what you're doing? Maybe not at the level you were doing, but you know, your body's constantly changing. And as we're getting, nobody's 18 anymore. As our bodies are changing, we want them functioning at optimal health. So that's one of the reasons to, you know, before, during, and after to get care. It's almost, I tell my patients, this is kind of like going to the gym and working out. Your body needs to move. Your body needs to be realigned. It needs to be put to bed on time at night. It needs water. It needs good food. You know, it's kind of simple, but then kind of not, because we're exposed to a lot of stuff we don't even know about in our food, in the air, everything.
Yeah. Don't get us started.
So we definitely want to counteract that the best we can by getting the rest that we need, getting the good water that we need, you know, managing our stress, things like that. And part of all that, for me, the basics are chiropractic, acupuncture, nutrition, and massage. Right there. You've got that. You're up, you know, so far ahead of everybody else.
That's a big one where I want to help people and myself to managing those things where your body's like, relax.
Yes.
How long is the treatment? Because I fell asleep, so I have no idea.
Yeah.
I felt like I was there for hours, but I don't think so.
I have patients that come and do everything, like in a treatment. So they'll get adjusted, then they'll go to massage, and then I like the massage before the acupuncture, because when you get massage, we call it massage drunk. You're like kind of, don't get in your car yet.
Yeah, you're like, oh my God, I can't get out of bed. I'm
yes,
so
you don't want to move, you know. And even after the
That's
acupuncture,
true.
you're like, oh, wow, I feel so relaxed.
That's me.
And some people, for the first time, their body has never been relaxed since they were little kids. People bring that childhood trauma all the way into adulthood and can't figure out why they have anxious, why they get mad fast, any of that stuff. But it's because the body's out of balance, and maybe even, you know, emotionally, they have too much weight on their soul or their, you know what I mean? And so by winding that down and letting them relax, you're like, wow, I've never felt like this before. I'm so calm. You know, for me personally, opening this business, this was not in my genre of things to do in my life again. But it just was one of those things. I just felt that I needed to do this. And so it's been, you know,
rewarding, probably.
It's been rewarding, but also having to deal with the insurance companies and things like that, which you know, it's just a little part of what I do, because I love treating people, and I love, like what you're saying, makes me feel so good that I sat for many years in classes and learned and got poked and got adjusted. But it makes it all worthwhile to me to be able to put my hands on somebody and help them. That means everything. But, you know, it's important that these are simple things that we can do to make your life better.
Right.
That's all I want to do, is help people make their lives better.
When I was on that bed, though, the table, it felt like I'm telling you, it felt like hours. But can you tell me how long?
You were there probably 20 minutes.
So yeah.
I always tell people 30 minutes for acupuncture, but it really doesn't take that long. That's the change time. I schedule 30 minutes for the acu, but that includes dressed and getting undressed.
So in the perfect world, how you said, adjusted, massage, acupuncture, and then how long is that time frame?
Well, it depends on how long they want a massage. We offer 30, 60, and 90 minutes, so it just depends. So they could be there literally for like an hour or 2 hours.
But the acupuncture is usually just 30 minutes?
About 30 minutes. I schedule a 30-minute appointment.
Is there anything longer? No.
90-minute massage.
No, but just the acupuncture is 30.
Yeah, that's all you need. Yeah, that's all you need. Because after a while, people get... they'll have to go to the bathroom because it starts stimulating stuff to work. So.
Oh, I was knocked out.
Yeah.
And whatever you did to my head, I was like, oh my gosh.
Yeah. I saw you later that evening and you still look like you were like zen, calm.
I want you guys to experience this. So the question now is it do you have programs? First of all, how much? And are there programs if they're not going to use insurance? You know, what can my people do to get to see you?
I'm on all the insurance.
And they cover?
Insurance. They usually cover. It depends on the person's plan. Now I have patients that have been my patients that are like, okay, I'm switching plans. Are you on it? Does it have acupuncture? If not, I have packages, chiropractic, acupuncture, $50. It's inexpensive. Do you know what I mean?
What's expensive is your hospital bill.
The hospital bill and
so be proactive.
Yeah, bankruptcy from health problems, that's expensive. So this is where we start. I always tell my patients, I'm like the little contractor, the plumber, the electrician. I look for all these things. But if the big ones are the architects, the people that design, the medical doctors, the surgeons, those people. I look for little things before you have to get to that point, before the whole house burns down or falls down. This is what we're doing, the little things we can do to make major differences in your body.
And you said you have packages. So you guys hit Doc up and find out, because I definitely want to have you guys experience what I did.
The wonderful thing is that now, I don't know what's happening so much with the insurance, but they're starting to I have patients that have unlimited acupuncture. I'm like, I never even heard of that before.
Well, let's find out.
Yeah, it's really great. But I think the insurance companies are starting to see that it's easier to keep people healthy than to work in the Western model of the sickness. It's not about wellness. That whole thing is about sickness. What I do, chiropractors, acupuncture, it's about wellness.
Preventative, proactive.
The funny thing that it used to be like in China, that if the doctor didn't get the person well, they didn't get paid. So you better get results.
What?
For me, so I'm in practice by myself. So that's kind of my philosophy. I better get this person well. What do I have to do? So I have, like I said, I have a lot of things. I'm like Mary Poppins, have a lot of things that I like to use.
Well, the thing that you care though, and I know like you care, and that somehow translates into medicine because you care, you want good intentions for us. And like, think about it, we're go. And the very people you talked about, surgeons, all the high power attorneys, they need it too.
They do.
Because what is all your success and your wealth if your health is not good?
Yes, definitely. When I was down in Tucson, I treated some of my attorneys that I worked with. I did a lot of personal injury. I treated them. They felt better. They understood, why does this person need chiropractic?
Acupuncture, happy hour. Yes.
Why do they need that? Why do they need that? What are we doing? I'm just not sticking needles anywhere in a patient. How is it feeling? How does it make that body feel? And for me, I like, before you go to like the, all the meds and all that stuff, I understand people need that because they get hurt, but let's try some easy stuff first. And then we'll start with the PT afterwards. And then if they need, shots or whatever.
But that's what I mean. Open up your mind to the idea that it's worth it to try other options. Don't just go to the permanent thing right away.
Yes.
Removing a gallbladder, that's permanent.
Well, and the thing too is that we always want to realize that your body's programmed to heal itself. Get cut. What happens? The body heals itself. Well, what about accidents and things like that? That's major trauma, but it's still programmed to heal.
But if you heal the wrong way, though.
Exactly. That's what I'm saying. It heals anyway with haphazardly, like with scar tissue, but we want to lay that scar tissue down properly so you have the most ability to move. And it's going to be painful. I mean, people that get in accidents, you're probably going to have lingering pain, maybe forever. And it can start arthritis up sooner. So those are the reasons to take care of yourself too afterwards. My people that have been in accidents, I do my best to teach them about chiropractic, acupuncture, and tell them, okay, just because your case is closed and you're done, you still have a body, and now it had
only one body.
Yes, it had a major trauma. You've got to take care of yourself for the rest of your life now. Let this be a gift. Look at that accident as a blessing. That look, I found some way easy, non-invasive to take care of myself, so I can live longer and have be healthier, feel better.
Well, with regards to car accidents, I always say, trust me, you don't want a big case.
No.
You don't want that. No, you don't. You don't want to. If it's like, I don't know. It's just something I'm like, I know it's frustrating, but I'm glad you're talking to me right now. Because the alternative is I'm talking to the people who you survived. Right. So just, and then small accidents, I can personally say between my experience and, clients and friends, it's like, you might look at a car that's metal, right? And our bodies are made out of completely different things. Nerves, ligaments, water, bone, whatever. You can't always compare that as a direct thing. Like, you might look at a car that you're like, oh, barely any damage. Oh. But oh my goodness, the pain that someone can feel from something that looks like, like minimal damage. No. It's crazy.
The thing
the spasm.
The thing too, Christina, is people don't know is that women, don't have the muscle mass that men do. We get injured more than men. Those seat belts, they can shear your body. It's restraining you, but this is going forward. It's restraining here. Everything else is moving forward. If you get rear-ended, even a side swipe, our bodies are not meant to move so drastically like that. They're just not. So you get hurt. You don't have a lot of damage on your car, but those bumpers are built to sustain that. All that force, G-forces, move through the body. You get injured. You really do. It's so important not to just let things go. Go get checked out immediately.
Yeah, because you'll regret it.
You can have new symptoms up to 2 years later. I was shocked to hear this stuff.
So true.
That's why a lot of times they want to settle.
And then they call us and it's like, sorry, it's too late.
Yeah, because they've already settled for maybe $1,000 on the phone with the insurance company because, I don't feel too bad today. Wait for 3 or 4 weeks when you stiffen, you can't move. So it's important to get good representation, get to some place, get checked out, and it's okay if you don't feel that bad, go get checked out. Bring your children. I check a lot of children. Take your kids. They can get hurt. Those seatbelts on a child can literally rip their insides. The lap belt on a child, you have to be so careful. Now the car seats and stuff are better, but still, you put a baby that's not meant to be in a car seat anymore in a seatbelt.
And you're right. Just a lot of it's just not knowing, right? Just like the car seat. Once it's in an accident, you got to replace that. Most people don't know that.
They don't know it.
But
and they're not cheap either. They're like $700-800 now.
I know. Going back though to the car, I just, how under the bumper, I guess there's the technology, I don't know if I'm saying it right, but to your point, where it's built like that, where there's an accordion piece where it's it might look fine, but inside, in my experience, it's okay, especially if what is that called? The truck has a hitch.
Oh, yeah.
And then maybe this car looks this way, it's fine. Yeah. That car is damaged because it went under, but then that car has frame damage. You wouldn't know unless you take it apart. With a computer system, I experienced that where it's it's all, my sensors are just all messed up.
Right.
So that's why you have to go seek help and, from professionals.
It's absolutely true. It's absolutely true. I always tell my patients.
So you don't regret it.
Make sure if you got rear-ended, make sure they take that bumper off, and whatever they're telling you, they have to remove it and look up underneath and see what has happened. Is the frame bent on the car? If that frame is bent, the car's basically no good anymore. And that means that happened to your body. You need care. You need,
Yeah, put yourself first. And it's especially because you only have one.
Exactly.
And
people don't realize that till it's too late. Mm-hmm. Even now, start taking care of your kids, and then as a teenager, and then you get to a young adult, care for your body. You only have one. And a lot of young kids now are not well. A lot of young adults, they're not well. They've got all kinds of, things going on in them that we didn't see like 30 years ago. So,
well, I mean, think about the generation where the processed food started.
I know.
So, and that's a whole different conversation.
Oh my gosh.
But, if for anyone like listening and this resonates with them, and maybe they haven't been to the gym and they haven't been eating well and they don't feel good, what guidance can you have? Justin's raising his hand back there. Anyway, what guidance, where do they start? Like start right now. And then what are the things that they can do to get started, to still take care of yourself?
I think even before you come see me, number one, what kind of water are you drinking? Are you drinking enough? How are you sleeping? Do you go to bed by 9, let your hormones, everything reset? How do you manage stress? What are you putting into
Shopping.
Your body?
Just kidding.
Exactly. What are you putting into your body? What kind of food are you eating?
Tequila. Just kidding.
Oh my gosh. Yes. You know what I mean? Those are the simple things you can do at home. Walk a little further, park a little, little further away.
Intentional movement, apparently.
Yes, movement. Do you stretch? Look at, if anybody has animals, you see they do, I call it cat yoga, dog yoga. They stretch. A lot of people don't stretch. When they come to my office, they can expect to stretch. Because that's what we're going to do. We're going to stretch you a little bit, before your treatment, maybe after your treatment. Just move. Start moving. We don't move. If you don't move, you're going to get stuck. The body's going to be stiff. And
I'm talking like, because obviously I love all my family and friends. And I just want them, all of us, to have a better outlook on our own health and taking care of ourselves so that we can age gracefully, right? Yeah. Dr. Yas always says that the work we have to do now is right now so that when we're 60, 70, 80, that we are not in some of the conditions you see, our posture, or we can't walk. Exactly. Like, she said something about how first of all, apparently when you're 40, you start to lose more muscle or something like that.
It starts at 30.
Okay.
It starts at 30.
And I listened to that woman. If you guys don't know their podcast, it's Siblings RX. And it's Dr. Yas, Dr. Roddy with BackFit. I will listen to Dr. Yas and Dr. Roddy. They know their stuff. And then Dr. Yas looks the part, And, but she mentioned something about how if you exercise now and make your body strong, especially like the lower half. Mm-hmm. So when you do get old and then you do, slip, that the chances of not having to do hip replacement is huge. And then for you to just get better as opposed to that. And that apparently when people who do go through hip replacement, it's hard to recover. And some people don't,
It's absolutely true. I've even seen my patients that I've treated them for a long time, on a regular basis, they get in a car accident. I'm like, aren't you so glad that we were treating you? They don't sustain as many injuries. They get well faster because the body's balanced. So take care of the body, the only one you're ever going to have. We can't replace everything. You can get new knees and hips, shoulders. I haven't seen a really great repair job on that. But take care of what you have. Yes, it gets frayed and doesn't work well if you don't use it.
Well, and then it's like, and I get it. Like, it's stressful. They have responsibilities. They have kids. They have sports. Right. But it's like, guys, take care of yourself because you do have to continue to do all those things and you have to show up for everyone. So show up for yourself. Obviously, easy advice, but it's always harder on yourself, right? Mm. But it's like just constantly trying to educate them on how important this is. Because it does show up 8 months later, or how you said 2 years later when it's too late. Yeah. And, it is inconvenient, to have to show up for these appointments. But it's like you're preventing issues later.
You really are. And I think, too, as women, we tend to take care of everybody else before ourselves, and that's just really the wrong way to do it. I learned the hard way, too. So really, especially with my women patients, I'm like, listen, take care of yourself first. Let's do this for you first. You'll have more for your children, for your husband. And then I always tell them,
don't feel guilty doing that.
No. And I always tell them, listen, would you rather take care of a grouchy old guy, or would you rather me take care of them? In other words, I'm going to take care of them. If we take care of them now, you're not going to have that. When you retire or whatever you want to do, you're going to be healthy. Do these simple fundamental things to be, your brain will work better. You'll be happier. You'll be able to move, and those things are important. I mean, anybody can sit in a chair and not think or watch TV all day. But we don't want that. We want to be moving and playing pickleball and running around and doing all kinds of stuff with our brain.
You don't want to be restricted or limited to, I can't, do this because I feel this, when you could have started now.
Exactly.
Can you explain like the whole subluxation thing?
A misalignment in the spine. Yeah, so I call it misalignment. Subluxation is what we use. It just means that bones, have you ever heard of a scoliosis? Mm-hmm. Okay, so those bones are misaligned. Sit
upright, Justin. Yes. Sorry.
Those bones are misaligned, very misaligned. Subluxation is minor symptoms of that. But those misalignments, they can cause the nerve, even the pressure of a dime can cause the nerve that's connected to all the organs and everything, can cause them not to function well. So that's one of the reasons why we look at the spine as chiropractors. Medical doctors use needles and scalpels and stuff. We use the spine to enter into the body, because everything that happens in your body is processed through the spine from the brain down. We heal above, down, inside, out. That's what I tell my patients. This is how you're going to heal, from your brain down. I'm connecting the brain to everything else. We're going to feed you properly. We're going to balance you so that your body can heal, repair, and flourish.
Dr. Briner, you'll meet her soon. She's lovely. She's in Awatuki. And she always talks about how your nervous system, your spine, all the things, that's so important. All of that, educating people. She's in my BNI integrity. And it's like, I didn't know, and most people don't know, it's related to so many more things, allergies, had no clue, maybe it's just, I'm fascinated by it. And then I met you and I'm like, okay, we can help more people. I just want you guys to feel good, feel better.
That's so great of you.
Yeah. Well, definitely going to have you in more topics too, but I can't let you leave really until you decipher why, sometimes like following a car accident, some people heal a little better faster, and some people it's like lingering pain, right. And then the spazzing, and then don't get started on the TBI. That's a whole other thing. But what is the biggest thing in a car accident that produces that?
It's the ripping and tearing of the muscles, I think. And that maybe even the misalignment, it fires off the nerve. There's bleeding from the muscles, shearing, just those forces that go in a car accident. So that stuff, the pain is instantaneously. And then a lot of times, like I said, they heal with scar tissue. That tissue is more prone to injury, more prone to pain. If you haven't corrected your spine, it's going to heal improperly, So as chiropractors, what we do is realign that so that as it's healing, it has the most strength. For myself, I heal them, then I work with send them to the physical therapist after they've healed and had some care so that they can gain more strength too. We want the body to be strong again. So I work with the physical therapist. I don't do a lot of that type of therapy because I have so much already. I send it out, because I'm doing other stuff and I don't have the time to do that. I do what I love. Those guys like to do exercises with patients. I don't mind, but not like they do. They have all the equipment and stuff. So
if you're trying to get a person better, send them where they need to go to get better. But, I feel like I've noticed, like, first of all, when you get hit, two things. One, it's coming.
Sometimes. Yeah.
Right. One, like, meaning you tense up and then it's like worse. Or you have no idea. And then it's like you're slouching or sitting upright, looking left, looking right, maybe looking. Right. It's just like, does that affect how you're injured?
Yes, it does. Say if you're even looking up or your head turned. Those things are all important and can change your injury a lot. That's why, they ask those type of questions. A lot of times people that are driving drunk, they always
Don't
survive.
do that.
Yeah, no,
don't ever do
but
that.
They always survive. They kill everybody else, always survive. Their body's like a rag doll. You know what I mean? So, yeah, you have to, we can't be texting on the phone or doing all that stuff when you're driving.
Or emotionally triggered.
Yes.
Like mad, angry. Like,
Yeah,
please don't
road
take
rage.
it to the road.
Yes.
I have this new thing I've been wanting to give up to people. We're going to order it where it's like, we might put it on the billboard actually. It's like, something about driving safe or no text is worth a wreck.
Yeah, I've seen that.
And because your family's waiting for you.
They are.
They are.
Your
Your loved
really
ones are waiting for you.
Yeah, it's just not worth it. I mean, texting is great. It's great to communicate with somebody like that, but not when you're driving. And it's not, you may be a great driver, but guess what? The guy behind you or in front of you or turning is not. Maybe drunk or texting or something.
Especially, like, think about this for a moment, Justin, okay? Justin's always in the background.
Oh, I love
but and we all do it. You're like 5 minutes away from where you're going. Yeah. So as a courtesy, you want to be like, I'm almost there. But some people don't make it there.
No.
So don't do that. No. Don't text, because now that I'll be there in 5 minutes, you will never be there. Yeah. Because we've had clients like that.
Yeah.
Where that simple, like,
they started putting up signs. So I live in Gilbert. They started putting up signs that says no text is worth a wreck. I'm like, thank you. Thank you. Let's
Yeah, we've seen that, and we've been like sharing it because it's true.
It really is.
Like, it's just
years
not
ago
worth
we didn't
it.
text and drive. Then texting came, and now everybody, or even so my husband drives. He says there are people like watching their computer because he's high up. People watching movies on the computer.
Oh, don't get me started on what I've seen. Doing driving? Makeup, like lipstick, and it's obviously it's different for us because we're in this industry, and it's like, please don't do that. Right. Like, it's just not fair.
And they can tell, like, the black boxes on the cars, they can tell, like, what you were doing, what even your phone will record, okay, what were you doing while you were driving? They have, working for the attorneys, they have all kinds of ways to, in my classes that I take about.
Well, it's just not responsible. It's selfish.
No,
and obviously,
you're absolutely right.
I've been guilty of that because it's like, I got a text. Now I don't do that. That's why you see people, I have my amazing team. They'll switch off and drive me because, to give you an idea, I'll drive to Tucson, might take 2 hours, never put my phone down. Yeah. So driving back, never put my phone down, right? Because they're allowing me to work. But think about if I'm driving.
Yeah, you can.
And so it's like, it's just, I've learned to. There was a time when I'd tell you guys don't text and drive, but I was doing it. And I'm like, shouldn't do that.
Yeah.
So
it's just not worth it.
My girls need me to come home too.
Yeah.
So
that's true.
We want everyone to feel good, and I want my friends to find you and everyone else. So remind them again how to find you, and if they can take advantage of that free. What did you call it?
Complimentary acupuncture, yes. I just want everybody to experience it, Well, I have 2 numbers. One is my cell number, my business cell. Okay. That, and I'm in Mesa, and I'm taking new patients, So come see me. I'll take care of you, and you get to experience acupuncture and the other things that I do.
Perfect. So. The next time you see Doc, we're going to be talking about all the things women go through.
Oh, gosh. That's a lot.
That's a lot. So thank you so much for your time. We can't wait to have you here, and congrats on your new office and all the people you're going to be able to help with what you know. So until next time, bye.
Thank you.